had an illness like rubella during pregnancy or was taking specific medications. But, and this is so important, these are just correlations. They're not guaranteed causes.
Instead of getting bogged down in a bunch of really complicated medical names, it's much easier to just group the types of CHD by what they actually do to the blood flow. So some defects send way too much blood to the lungs, which can overwhelm them. Others send too little. Some create blockages, like a door that's just stuck shut, and others are literally like holes in the walls between the heart's rooms, causing blood to mix when it's not supposed to.
Okay, so we've got a handle on the problem and the different types. Now for the really important part, the action plan. How do we find these things and what can we do about them?
Finding a CHD can happen at a lot of different points in time. Sometimes a problem gets spotted on a routine ultrasound before the baby is even born. For other kids, a doctor might hear a little whooshing sound, a heart murmur, right after birth. Or maybe a parent notices symptoms, like their baby is breathing really fast, has a bluish tint to their skin, or is just having a really hard time feeding.
Now, this whole journey can sound pretty intimidating, but it often follows a clear path. It might start with that first detection, which leads to an official diagnosis. Then a treatment plan is put together. For many, that's going to involve surgery or some other procedure in the first year of life, and that's followed by a lifetime of regular checkups to make sure that little heart stays as healthy as possible.
And this is where the story becomes truly incredible. The medical advancements have just been astounding. I mean, think about it. Just 60 years ago, many of these conditions were basically a death sentence. Today, surgeons can perform these unbelievably delicate repairs on hearts that are no bigger than a strawberry. It really does capture that feeling of miraculous progress and so much hope.
All that amazing progress leads us right to our final section. What does the path forward actually look like? Because it's no longer just about survival, it's about thriving.
The big takeaway here is that the care doesn't just stop after a childhood surgery. Living with CHD is a lifelong partnership with your health. That means regular checkups with cardiologists who get it, committing to a healthy lifestyle, and, this one's huge, as patients grow up, it's so important they transition from pediatric care to doctors who specialize in adults living with CHD.
And why is that lifelong care so important? Because it works. I mean, this number says everything. Today, because of early diagnosis and incredible treatments, more than 90% of babies born with a heart defect will survive and live well into adulthood. That is one of modern medicine's greatest success stories, right there.
And that brings us to our last thought. The journey from a really grim prognosis to a 90% survival rate is just, it's staggering. It makes you wonder, right? With all the new technologies like